This is HealthCall Live Online, where you'll find extended versions of interviews featured on the HealthCall Live radio hour. I'm your health correspondent, Lee Kelsoon. The coronavirus outbreak in China is an opportunity to take a look at how our government is prepared and what plans are in place to handle a public health crisis here at home. For an insider's view, let's turn to Dr. Amesh Adalja. He's a senior scholar at Johns Hopkins University Center for Health Security. His work is focused on emerging infectious disease, pandemic preparedness, and biosecurity. Doctor, welcome. Thank you very much for joining us. I know you're a busy guy these days.
Yeah, thanks for having me.
You bet. Give the Chinese government a letter grade for how they have handled this coronavirus outbreak so far, can you?
So I would have to split it into multiple different subjects because a report card has many different subjects in it. So I would say with speed, with identifying the virus, getting the sequence out to people in terms, and also the communication about the virus to public health authorities, I would say that's like an A or a B, an A minus or a B for that, because this really is a huge improvement from what we saw in SARS. When it comes to what they're doing now in Wuhan with the quarantine that's going on of about over 20 million people and sort of the draconian type of regulations and restrictions on personal movement, I would say that that's not something I would even dignify with a letter grade. I think that's a really bad way of going about controlling an outbreak. We know that these travel bans, whether they're for a whole country or for a province or a region, make things much, much worse because you end up isolating that population. You're unable to get them the resources they need. We're hearing about shortages there. It actually will drive people underground. It will cause people to have more panic, and it just makes the outbreak much harder to control. So I do not support that activity at all.
So the concept, though, of social distance, I understand, is important in controlling the spread of an infectious agent like this. Are they not? So is that concept the right thing to do, but they're just applying it poorly?
Yeah, social distancing is something that can cut down on a spread of a contagion. So if there's a parade or a big social event that's happening, you might want to cancel that event in order to make it more likely that people are not going to mix. But that's very different than putting armed guards in places and having very ominous messaging. And I think it's one thing to do social distancing and have people voluntarily do that and cancel certain events and tell people maybe you should stay outside of big crowds and not do this or not do that. But then to use kind of military police power to do it when it may not be warranted, and we know from history that these types of things go very badly, that's a very different thing than pursuing social distancing.
Can you help us understand the scale of this threat? If the Spanish flu pandemic of 1918 is a 10 and the seasonal flu is a 1, where does this type of an outbreak rank on that risk level?
So it's definitely in between there, and I think it's hard to know exactly where to put this scale. So we know that it is deadly in certain cases. We have about 26 or so deaths, but those deaths seem to be, for the most part, clustered among people who are elderly, who have comorbidities, other medical problems. So that makes it difficult to really gauge the severity. There have been some reports of younger people. There was recently a report of a 36-year-old who died, but that's what we see all the time with seasonal flu. We see young people dying of seasonal flu every year. The question that really has to be answered is how severe is it, which we just alluded to, as well as how transmissible is it? We know that there is some human-to-human transmission going on. There may have been some instances of sustained human-to-human transmission, at least in China, with some family clusters that have occurred and some healthcare worker clusters. But it doesn't seem to have the force of a seasonal influenza type of thing yet. And I think it's very hard to know exactly where it fits. I think it's going to take some time to tease this all apart because we have this, what we call a severity bias. We're hearing about severe cases first and not hearing about how many mild cases there may or may not be. And we know coronaviruses cause a spectrum of illness. So I would put it somewhere in between. Probably if 5 is the middle, I think it's probably below that. If 10 is if you said 10 is the Spanish flu, 1 is seasonal flu, I think it's between maybe 2 and 5 right now. But I think that's going to change because this is a very fastly evolving outbreak and the science is moving really rapidly. And we still don't have basic questions about severity and transmission answered yet.
We see Chinese citizens wearing face masks. Are they at all effective in this situation? Viruses are so minute. They're going to get around a face mask in no time at all, right?
face masks work so long as you can actually comply with them, and they're loose fitting, but they do block out large droplets. So if somebody sneezes on you or coughs on you, it will be shielding. However, the issue is that people don't necessarily wear them with really good compliance. They're often sticking their hands underneath them, itching their face, itching their mouth, taking them off when they're on the phone. So it really has to do with compliance. So I don't think it hurts anything. And if you're really meticulous with it, maybe it would help. But it's often the case that people don't wear them as they should be worn.
So better than nothing, but not great. If this outbreak were in Pittsburgh, where you have an infectious disease and critical care medical practice, instead of in China, what plans are in place and how would our government be responding right now?
Well, our government has been preparing for infectious disease threats for quite a long time, basically in earnest since the anthrax attacks in 2001, and then more so with bird flu. And we have been stressed with having to deal with SARS back in 2003. There were U.S. cases there, and Middle East respiratory syndrome, where the United States has had 2 imported cases, and we did a lot of preparation. So right now, what hospitals are doing mainly is really fortifying their ability to detect cases and detect patients that might be at risk. And that's really done through travel screening. So you will see places that have electronic medical records increasing their prompts for their triage nurses to ask, have you been to places where this novel coronavirus is circulating, such as China? And we already do that for MERS, for Middle East respiratory syndrome, asking patients if they've traveled to the Arabian Peninsula. And we've been doing that in the past for Ebola when there was an outbreak in West Africa, and now there is another outbreak in the DRC. So that's the first line. The second thing is trying to understand what you would do if you had a patient under suspicion. And most hospitals have the ability to isolate patients and put them into airborne precautions, which is what the CDC recommends, and then coordinate with their local or state health department to get testing done through the CDC. And having all those protocols in place and having messaging and communication to the staff, that's what hospitals are doing now. But I don't think that every hospital in the United States is at risk for having an imported case, although all hospitals should be prepared to deal with one if they see one. What we're seeing with the U.S. government right now is the funneling of patients to certain airports, which is going to kind of mitigate where these patients go, and they may be going to only certain metropolitan hospitals that are being well staffed and sourced. If this outbreak was changed and we had a large wide-scale outbreak in the United States, I would hope that we wouldn't be doing any kind of quarantining like what's going on in China. I would hope that communication would be completely transparent, that public health authorities would be talking to the general public all the time and updating case counts, updating risk factors, and really getting to the bottom of it quickly and letting these questions be answered as soon as possible about severity, about transmission. But I think it's a hard thing to imagine in the United States. But I do think that we're prepared, in one of the best countries that is prepared for infectious disease threats.
Well, so in an outbreak of this scale, who's calling the shots? Who has final word on policies, procedures? Who has the ability to suspend individual rights if it comes to all of that? How does that work?
Well, that's all going to be based upon each country. So right now, China is in charge of this outbreak. This outbreak originated there. That's the epicenter. So whatever the cases are, each country, there is no world government that can do that. The WHO and other public health authorities and bodies can talk about what's supported by science, what's supported by medicine, and what isn't.
But how about here at home? How about in the United States? Who is the ultimate authority there?
It's the state and local governments have primary authority for public health. The CDC can come in when they are asked. There are some federal quarantine and federal public health powers, but largely those are not exercised, and this is left to individual states. And we saw that with Ebola, where you had certain states had certain restrictions, certain states had other restrictions. So it's really at the state by state level.
Didn't that cause problems during the Spanish flu pandemic? I know, for example, some cities canceled all the Armistice Day parades. Other cities didn't, and those that didn't had higher infection rates. Yes,
it does. When there's variability, and some places are doing social distancing and others aren't, people may still contract the illness. You want it to be, you sort of want it to be uniform, but in a system, all 50 states kind of have their own ways of going about it, and the CDC can provide guidance on what the best evidence is, but it's still, because we have a federal system, the state governors are really in charge of this, and you can only do so much to persuade them. And we saw, for example, in Ebola, bad policies in New York State and New Jersey regarding how to deal with people who had traveled back to Ebola. We had a poor nurse that was stranded on a tarmac in New York for no reason at all.
So what is the role of corporate America? What role would they be asked to play if we had a really significant, a major outbreak?
Well, it's really important that you think about pandemic response as something that's a public-private partnership. There are many resources in the private sector that are needed. Like if you think about, airplanes, transport, vaccines, medications, IV fluids, food, uh, logistics, computers, and every industry can contribute with a pandemic response. And it's really important that we have industry engaged. And for example, the Center for Health Security, where I work, recently did an exercise called Event 201 with the World Economic Forum. And the purpose of that was to emphasize the private sector's role in pandemics and having them engaged and preparing for them because they are such a major component of this. So you would hope that major corporations, especially ones in critical industries, would have pandemic planning as part of their continuity of business operations work, and that they realize that they do play a major factor in whether you're successful in containing an outbreak or not.
That sounds to me like you've just identified a major gap in our preparedness. I am quite sure that major corporations haven't thought down to that level at any great scale. Do you have evidence they have? Are we vulnerable because of that?
I do think that we're vulnerable to the extent that the private sector isn't engaged. We know that the healthcare sector is engaged, the pharmaceutical industry is engaged, anybody in the healthcare sector is engaged. But it's important that we have the transportation industry, the airline industry, the power industry. All of those industries really have to be at the table when you think about how you prepare for a pandemic and how you make your country or your region resilient. And when they're not engaged, we find that would be something that would leave us vulnerable, because this isn't going to be something that a government is going to be able to do on its own. It's going to require private sector resources.
Yeah, and as fractured as government is today, I think the thought of putting my safety in the government's hands is a little bit worrying. I won't ask you to comment on that. I look to the Spanish flu pandemic as, with those 100 million people dead around the world, as a worst case scenario. Now, is that correct, or do you see something out there that maybe isn't a viral outbreak, or what is the greater risk? Could that happen again today?
In many ways, the world is safer from pandemics in 2020, and in many ways, it's more at risk, because right now in 2020, we have a very interconnected globe. Viruses and bacteria, anything can travel at the speed of a jet. In the past, they traveled at the speed of a steamship. And that's a major difference, because something on one side of the world can get to the other side of the world within 24 hours without any problem. And it happens all the time. There are issues with megacities as well that we didn't have in prior eras. There are many cities around the world that have large populations that are in crowded conditions. Some of them lack basic sanitary conditions, and that really looks as almost like a tinderbox for these outbreaks, which we didn't have in prior eras. However, in 2020, we do have antibiotics, we have antivirals, we have vaccine, we have better sanitation, we have really sophisticated diagnostics and genetics tools that can be brought to bear. So it's hard to say exactly where this would fall in terms of risk, if we're more or less at risk than we would be in centuries earlier. But there definitely are forces going both ways.
So what worries you the most? What type of a viral outbreak, or whatever that antigen might be, what keeps you up at night?
I'm really worried about RNA viruses, and coronaviruses are RNA viruses. Those are viruses that use RNA as their genetic material. Of these types of viruses, the one that I think always is on the top of the list is flu, and specifically avian flu, because we know that flu can cause severe pandemics. It did so in 1918. It did so in 1957. It's done that multiple times and shown it can do that. It is a very tricky virus with multiple different segments in its genetic structure that can reshuffle. It infects animal species, and we do know that when you see bird flu cases, they can be very, very, very severe with high mortality rates. So of the pandemic threats, I think bird flu is the number one on most people's list that have actually went through this type of data.
What do you expect to learn from this current outbreak in China? What lessons do you think we're going to carry forward?
The lesson I think we're going to learn is one that we've learned before, that transparency and speed with response to an outbreak is key. And I do think that the fact that we were able to get diagnostic testing done quickly, that we were able to get the genetic sequence done quickly, those are really good lessons, because that's helped with controlling this outbreak, even though it seems to many people to be out of control. I think we'll also learn that travel bans don't work, and that can make things worse, and that can cause distrust among the population. And I think hopefully we will learn that the world is always at risk for these infectious disease emergencies, and it is really important to be preparing for them, even when there is not one, so that we are ready to act when one appears, because these viruses are going to continue to impact the human race forever.
Excellent segue into my next question, and that is, at a family level, what preparation should we have in place should this just come out of the blue and whack us next week, next month, next year?
Well, families should have, it's hard to say, it depends on where the family is. I think in the United States, I don't think that people need to be worried or panicked about this. Obviously, there are normal public health preparedness actions that they can take all the time by having, adequate supplies of food and water, and having batteries, and having all of the types of stuff that you might need, even if you were to have a blackout. Sort of preparing for all hazards is what the norm should be. There's nothing specific you would do differently for an emergency caused by an infectious disease outbreak versus an emergency caused by an earthquake or something. So I think this is all part of the general preparedness that you do in your house and in your household, to be prepared for any kind of hazard that may befall you based on where you live and what the risks are out there.
Anything I didn't ask you, you think is important, you think people need to know?
I think it's really important to watch this outbreak. I want Americans not to be panicked about this, but it is something that they should be alert to and following the news on, because there are important events that are happening in the other side of the world that could impact us. And I do think we will get more cases in the United States, and it's important to expect those cases and not to panic when we get them. And I think it's really important to listen to public health authorities about what the best actions are to take at any given time. And if you're traveling to places where there are outbreaks, it's really important that you look at the CDC website and look and see what's prevalent there. And right now, the CDC has a level 3 advisory, so do not go there to Wuhan unless you have essential for any non-essential travel. So it's really important to keep abreast of that for any outbreak, not just this one.